Welcome to One Training, where we provide health and fitness content to help you achieve your goals. Choose the fitness course professional athletes trust. Click the link in the comments to learn more.
Hi everyone, Chris from One Training here. So just want to do a quick video about blood pressure monitors and how they could help us in client fitness consultations, okay? So we'll talk about the monitors themselves, we'll talk about how to use them properly, and we'll look at why they're such a valuable tool when we're working with clients. So let's start from, I guess, some of the benefits of measuring blood pressure and why we do it, okay? First and foremost, it's easy to do. It's very low cost, okay? And again, this is something that normally we might go to a GP for, but because of the ease of use and the technology that's come through where they're almost automated, you simply put them on and touch a button, okay? Unless you want to do it the old school way, which is just as accurate. But again, the ease of use, it makes them really a really simple addition to your own pre-screening when working with new clients, okay? So again, if we're going to test some blood pressure, let's talk through how we do it. So we get the client, comfortable and ready, and just make sure they're obviously consenting and on board to it. We get them to sit nice and comfortably and as relaxed as possible. So, nice and upright, feet flat on the floor. And we're trying to get their arm to just sit in a nice sort of, 90-degree relaxed position, ideally resting on someone, on something. So the arm of a chair or a table is perfect. We simply put the blood pressure cuff around the upper arm, okay? And we want the edge of the cuff to be just above the end of the elbow. So not too low, not too high. So just so it's comfortable and not sort of rubbing in that elbow crease there. So again, one important thing with the reading of the blood pressure monitor is that the kind of hose, or if you're using it the old school way where the stethoscope comes out of the cuff, okay, we want this to be towards the inside of the elbow crease, okay? It just gives it a more accurate reading at the end of the day, okay? But just be aware that if you can, we just try and angle the position of that specifically just inside the elbow versus outside or right in the middle, okay? So from there, whether we're pumping or using the button, we inflate the cuff, okay? So essentially, the cuff's going to inflate until it's snug, but not super, super tight, okay? So that from there, the monitor, or the sphygmomanometer, they call it, is going to detect and display the client's blood pressure reading by, again, just releasing pressure slowly, okay? So the first number we're going to take note of, or the top number, the bigger one, is what we call the systolic, okay? And the lower number is what we call the diastolic, okay? So these different pressures basically show when the heart's pumping and squeezing and when the heart's relaxing, okay? So again, once we've taken those two numbers and got our reading, we've measured blood pressure, okay? It's as simple as that. So again, it's really, really straightforward once you know how to use it. But the main reason we do this, keep in mind, is that if there's any abnormal readings, so any numbers higher than 120 for systolic and 80 for diastolic, again, we would often refer out to a GP just to be, on the safe side, okay, if they haven't got a referral in the first place, okay? So that's it for today. That's our video on blood pressure.